Thank you for joining us today. Today's presentation is for educational purposes only and not provided as consulting, coding, or legal advice. This video addresses physicians furnishing either the entire global package or when only part of the global surgical package is furnished. This is a complex topic and may not be all-inclusive. Please check with your major payers to ensure you are following those specific guidelines. The usual pre- and post-operative care is included in the package when the surgeon furnishes all services. This is reported on the claim by assigning the most appropriate CPT code, which includes the entire global package. When different physicians in a group practice participate in the care of the patient, the group practice bills for the entire global package if the physicians reassign the benefits to the group. It is possible that the physician who performs the surgical procedure does not furnish the follow-up care. Payment for the post-operative, post-discharge care is split among two or more physicians where the physicians agree on the transfer of care. One example would be a patient requiring emergency surgery while on vacation, but here the post-operative follow-up care is likely to be performed by a surgeon back home. There are specific guidelines to follow under this type of circumstance. When more than one physician furnishes services that are included in the global surgical package, the sum of the amount approved for all physicians may not exceed what would have been paid if a single physician provided all services, except where stated policies allow for a higher payment. For instance, when the surgeon furnishes only the surgery and a physician other than the surgeon furnishes the preoperative and postoperative inpatient care, the resulting combined payment may not exceed the global allowed amount. Both the surgeon and the post-op doctor must keep a copy of the written transfer agreement in the beneficiary's medical record. Where a transfer of care does not occur, the services of another physician may either be paid separately or denied by medical necessity reasons, depending on the circumstances of the case. Split global care billing does not apply to procedure codes with a 0-day post-operative period. Append either Modifier 54 or 55 to the surgery CPT code. Modifier 54 is used by the surgeon performing the surgery only and not the post-operative care. Modifier 55 is reported by the physician rendering the post-op management of the patient. Both physicians use the same CPT code for global surgery services billed with modifiers 54 or 55. There are exceptions to use of modifiers 54 and 55. For instance, when a transfer of care didn't occur. The occasional post-discharge services of a physician other than the surgeon are reported by the appropriate evaluation and management code. Another exception is for minor procedures performed in the ED. If the services of a physician other than the surgeon are required during a post-operative period for an underlying condition or medical complication, the other physician reports the appropriate E&M code. No modifiers are necessary on the claim. An example would be a cardiologist who manages underlying cardiovascular conditions of a patient. Both the surgeon and post-op provider bills the date the surgical procedure was performed. Modifier 54 indicates that the surgeon is relinquishing all or part of the post-operative care to another physician. Modifier 54 does not apply to assistant at surgery services and also doesn't apply to an ambulatory surgical center facility fees. The other physician furnishing post-operative management services bills with Modifier 55. Tips to remember. Use Modifier 55 with the CPT procedure code for global periods of 10 or 90 days. Report the date of surgery as the date of service and indicate the date that care was relinquished or assumed. Physicians must keep copies of the written transfer agreement in the beneficiary's medical record. The receiving physician must provide at least one service before billing for any part of the post-operative care. This modifier is not appropriate for assistant at surgery services or for ASC facility fees.